So we're going to assess for the external anatomy to perform a surgical cricothyroidotomy. So if I'm using my left hand to use the scalpel, I'll be on the patient's left side. I'm going to take my hand, and again, using that laryngeal handshake, I'm actually going to start down at the sternal notch because I'll be able to find that in every patient. You'll see my thumb and my fingers are on either side of her larynx. And I'm just going to softly palpate up until I find what I think is the cricoid ring. I can feel a little bit of the cricothyroid membrane. I can feel that larynx good. So once I do that, I'm going to use, again, my thumb and my fingers to palpate that cricothyroid ring. Also notice that the backside of my hand is pushing against her jaw, so if she was flaccid, as she would be if I was performing a surgical airway here, that's going to help push the jaw out of the way, particularly in settings of massive facial trauma where I might need to be doing a surgical airway. So again, start at the sternal notch, walk your way up with your finger. This is a palpated procedure. You're not going to be able to visualize anything. My first little bump is going to be my cricoid ring. I'm going to feel a little depression, which is my cricothyroid membrane, and I'm going to feel the thyroid cartilage. Thumb, fingers on either side of that. I can stabilize that, and every time I lift up and drop down my finger, I'm putting it right back down on that cricothyroid membrane. I then take my scalpel and then begin the incision.